Whelan Presley Funeral Home and Crematory, a proud supporter of WQPT, has been serving Quad City families since 1889. They now have live stream capabilities for viewing your loved one's funeral or memorial service.
At IHM VCU, we've always been here for you. You are and always will be our top priority. We care about your financial and physical health, and we are here. IHM VCU is a proud supporter of WQPT.
What to do to make sure everyone has a fair shake at healthcare, and 50 years of celebrating the music of Bix Beiderbecke in the cities. COVID-19 proves something so many people know. Healthcare is not offered equally to every person. So what to do about it? Representative Cheri Bustos and 3 other House members have created a caucus that will look at healthcare disparities across the nation. One thing they agree on, it's more than just doctors and nurses. It's a holistic approach to improving neighborhoods in order to improve health. We talked with the Chief Executive Officer of Community Health Center, Tom Bowman, who's been out on the front lines of community health care in the cities. Did COVID underline just how bad the disparity is among the haves and have-nots when it comes to health care?
I think definitely it showed a light on some of the disparities, but I think many of the disparities that we see here in the Quad Cities and around the country have been fairly well known. But when it starts to come down to an emergency action like the pandemic was, it just had a big bright spotlight on where those disparities lie.
And take me where the status is right now, especially when it comes to COVID and the vaccinations, because it's so important to get these vaccinations to minority groups and perhaps underserved areas. Are you being successful in that area right now?
Yeah, I mean, I think we're making progress. Certainly, we know that there's been vaccine hesitancy, especially in African American communities and also in other minority groups. For a number of different reasons. And so, we made broadly available vaccine to anybody that wanted it through a number of mass vaccination sites, throughout all of the spring. And so now we're really focused on trying to tailor that approach, working with faith-based institutions, working with service agencies that work with minority groups. So it's changed our focus a little bit. We can't just do mass vaccination clinics. We need to get in and educate about the vaccine, the effectiveness, and then set up smaller groups. And that's what we're doing in partnership with the health departments and the health systems. We identify groups, and we have mobile teams that will go out and do, pop-up type of things where you might be doing 20 or 30 vaccines versus 400 in a day like we were doing during the height of the vaccine season. So we're just taking a more targeted approach, but we're making progress. We're not where we need to be yet.
And that's what I was wondering is that, let's be honest, when the vaccines were first available, people couldn't get them fast enough. And we saw the senior population really go for it as well because they were so badly hurt by the COVID-19 pandemic. So when you're saying it's targeted right now, who are you targeting? I mean, is it just people who just kind of say, oh, I don't want a vaccine, or is it just people who don't think it's accessible yet?
I don't know that there's people that don't think it's accessible. I think who we're targeting are those that maybe historically maybe have a mistrust of healthcare or the healthcare system, maybe a mistrust of vaccines. People that maybe think the pandemic is over or not a big deal in our area. We've seen our numbers come down considerably in the Quad Cities, so it's over. I don't need to worry about it now. So really going with those groups, and we do that through community health workers, and we have a dedicated vaccine team, and then, like I said, working through partnerships. And we talk to, it might be a church in Davenport or an African American church in Rock Island, and we go in and we talk with the pastors, and we talk with parish nurses, and try to educate those groups. So it's really, depending on which social service group you're working with, it's how do you get in front of the people that they serve and then educate them on the vaccine and try to convince them to go ahead and get it done. And some people really have been pausing because they want to see what the, quote unquote, longer term effects of the vaccine are. They might not be opposed to it, but they just want to wait and see. And so we've got to educate that the long term is really, once you get past 90 days, you hardly see any other negative experiences. So doing that education and doing it in a targeted way, that's our approach right now.
You've seen that Congresswoman Cheri Bustos has created this caucus in the House having to do with healthcare disparity. How important of a step is that, and what's the one thing you think they need to know?
It's a very important step, and Congresswoman Bustos has been an advocate for health centers and an advocate in health for a long time now. The focus of what I have seen of her program is really tackling social determinants, and that is exactly what we do here at CHC, and why we were created is to make sure that healthcare is driven by a number of factors. You have genetics, you have healthy lifestyles, and then you have medical care. But really, the biggest drivers are those social factors. Does somebody have affordable housing? Does somebody have the food that they need? Can they meet their rent and utilities? If they can't do those things well, then the medical care that they receive is not gonna move the dial on their overall health. And so, to me, it's very important that she's standing up at the federal level and bringing together other House members to join her in that caucus, so that we can come up with what are targeted ways that we can invest in our communities, so that patients that maybe come to CHC for their health care, we have a clean referral system or a smooth referral system. So if they also need help with housing, or they need help with transportation, or education, legal, those types of things will help that person manage not just their medical care, but also their social environment. And so we know that will improve overall health in the long term.
Community health care, of course, is located in the heart of many of the cities of the Quad Cities, getting to that population that live in what you might call an urban area. The other side of the coin, of course, is rural areas. I know that you're expanding your telehealth. Does that seem to be the big equalizer now, is the use of telehealth that will help both rural areas as well as some people who really can't make it to the clinic?
Well, I think telehealth can do a lot of good stuff. We definitely have expanded the use of telehealth here. I work with colleagues across the state of Iowa where it's very rural populations, and they're also using telehealth. It can do a lot from initial, meet and greet with your doc, get a health history, some of those types of things. We're never going to fully substitute some of the physical care that needs to happen in the physical exam, but definitely having access, especially on the mental health side, which is a big focus on the telehealth program, that tends to lend itself to better use over telehealth. But there's a lot of screening and other services that can be done via video and audio. So we think it's one tool in the toolbox. I think there's other opportunities for more mobile clinics, whether that's a bus or a trailer. CHC has 3 trailers now. We intend to go out into more rural areas and also work in the urban areas, especially with homeless populations. So there's a lot of tools there, but telehealth is definitely one that we plan to expand so that we can get to more of the rural areas around the Quad Cities.
Whenever you take a look at the health, the overall health of an area like the Quad Cities, the actual health care is one of those determinants of how good a community is. CHC has been a part of each of the communities. Have you noticed, because I'm sure you keep track of this, is the general health of the area getting better because of the access that you're providing?
Yeah, that's something that we do. We do what's called a community health needs assessment, and that's driven by both of the health systems, both of the health departments and CHC, and a number of other partners. So we do track a lot of indicators. There are some indicators that are improving, and then there's others that are either staying level or not improving. And so indicators change over time, and it takes a long time. I would say we've been holding steady, but we do have some that aren't moving the way that we would want. So for instance, access to healthcare has continued to be a challenge. The number of professionals that we have in the community and patients knowing where they can go to get primary care services is a challenge. We're in a health professional shortage area. So just that alone makes it more difficult to address some of those chronic disease states like hypertension, diabetes, cardiovascular disease. And so there are things that we're improving on, but we haven't gotten everything where we want it to be yet.
And you touched upon another one a little earlier, and that is mental health. We're coming out of COVID, and let's be honest, person to person has dealt with this in their own way, and it has been tough.
Mm-hmm. Yeah, I don't know that we've even seen the full effect yet. There's going to be a lot of mental health challenges. You of course have the anxiety and the concerns around the pandemic and the disease itself. But what we're seeing, we're on the cusp of a lot of the moratoriums being lifted on housing and some of that kind of stuff. You're going to see people that are going to be without shelter. That raises stress and anxiety. That has a mental health effect. Kids not being able to be in school. Those types of things all play a role. So a lot more social isolation and those things. So that is something that we work collaboratively with our mental health partners in the community, Robert Young, Vera French, two of those, plus here at CHC. So we're trying to figure out how do we expand services and make sure people know that they have a place to go, that they can have those needs addressed.
We are actually seeing an uptick in numbers of cases in our region on the Illinois side. I can't speak for Iowa right now, but on the Illinois side, we're seeing an uptick basically since the end of June, early July. Have you seen that as well, more COVID positive cases? And are you attributing that to anything in particular?
It's the Delta variant, I think, is what we would point to. It's in our community. It's more contagious. Our vaccination efforts have been robust, but we haven't gotten to a herd immunity. And so we still have a lot of unvaccinated individuals in the Quad Cities, and they're more susceptible, of course, to the Delta variant than others. So we have seen an uptick. It hasn't been a spike yet, I wouldn't say. And here at CHC, we haven't seen a big uptick in positive cases, but we're not testing as much as we once were. So we'll see. It's something we're watching closely with the health departments, and we want to just keep banging the drum on people get vaccinated. Even the things that you're seeing in the hospitals, the vast majority of people that are being hospitalized and or succumbing to this virus anymore, they're almost 100% unvaccinated individuals. So even if you get breakthrough with the Delta variant where somebody gets sick, they're not getting as sick if they've been vaccinated as if they're unvaccinated. So we still need to keep vaccinating, and hopefully we'll keep it from a big spike, and hopefully it's just a small increase.
Are you worried though? Because it's the small increase, as you mentioned, seems to have come after the 4th of July. A lot of gatherings on the 4th of July. And then you add Bix 7, and you add the Street Fest, and you add all of the other events. You add the county fairs. You know where I'm going with this. We've got a lot of crowds that are meeting. Is that giving you some pause?
I don't know if it's pause. Yeah, we worry. We worry about it. I think every healthcare organization that's been battling the pandemic from the start worries about large crowds, especially if there's unmasked, which it's going to be at this point. And so, yeah, we're worried about it, and we're prepared for it. Though we are still have our services in line to where if we need to ramp up operations to address those things, we will. So yes, we worry about it, and we kind of knew this was going to be coming as you roll back restrictions and quarantines and all that kind of stuff. It's just a natural cycle of any infectious disease that's airborne like it is. So we're worried about it, but we're also prepared to ramp up and address it if we need to.
Tom Bowman, Chief Executive Officer of Community Healthcare. In a moment, Bix Lives, now for a half-century of celebration. But first, we're entering the dog days of summer, and there are just a few precious weeks left before school starts. Laura Adams has great ideas for you, your family, your friends, who all want to go out and about.
This is Out and About for July 29th through August 5th. Get on over to the Green Valley Sports Complex for the 2021 North American Fast Pitch Men's World Series beginning July 28th. Or check out the Bass Federation Junior World Championships in Rapid City July 28th through 30th. There's plenty of free music available, including Thursday Night Groove at Schwiebert Riverfront Park, featuring Funktastic 5 the 29th and Been There Done That the 5th at 7. and Blues Rocket performs at Bass Street Landing on the 5th at 7. The Live at 5 free Courtyard series at RME features Ten of Soul the 30th at 5, and Music in the Vineyard with Lojo Russo at Tabor Home Vineyards takes place August 1st at 3. Plus, the Boss Brothers Old Fashioned Threshing Bee takes place in Erie, Illinois, July 30th through August 1st. On stage, Disney's Newsies, based on the film, performs at Countryside Community Theater in Eldridge, July 30th through August 8th. Richmond Hill Players presents Outside Mulligan, August 5th through 15th, while the Mississippi Valley Fair kicks off August 3rd and runs through the 8th. Plus, there's comedy at Renwick Mansion with Tomfoolery on Tremont featuring Eddie Pepitone on the 4th, and comedy returns with Improv at the Black Box Theater. Shakespeare performs July 31st at 7:30. For more information, visit WQPT.org.
Thank you, Laura. We try to spend some time each week highlighting a local musician who's creating original music for audiences in the cities. And that includes Jonathan Turner, who performed for us his original called Midwest Boy.
Just a Midwest boy and a Jersey girl, alone in New York, alone in the world. Night after night, the boy and girl wondered if they'd ever find the one, or would their hungry hearts be forever born to run. They thought, where are you? Where are you? Where are you? Where are you? To share with me the rest of my life. Just a Midwest boy and a Jersey girl. One day they met online, they let their feelings unfurl. With the touch of a mouse they clicked, got together the very next day. The date she was born, on their date she was reborn to stay. She felt, I found you, I found you. Rest of my life. Just a Jersey girl and a Midwest boy. She gave him hope, he brought her joy. Then one afternoon in June, she asked him to be bride. Though it was raining out, the sunshine streamed inside. He said, I love you, I love you, I love you, and I love you for the rest of my life. We're so happy to be here on your wedding day, to bask in your glow and let you know that we love you, 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 and we'll love for the rest of our lives.
Jonathan Turner and Midwest Boy performed at the Black Box Theater in downtown Moline. It was 118 years ago Bix Beiderbecke was born in Davenport, and 90 years ago when he died in his New York apartment. And this year, it's 50 years that his legacy as a jazz great is being celebrated with the Bix Beiderbecke Memorial Jazz Festival. This year, organizers say they're moving forward to put last year and COVID behind them. We talked with Jazz Society President Steve Traynor about the big plans for the festival. So this is the year celebrating 50 years. It really is tremendous to be able to say that.
Thank you, Jim. You're right. If the people who started this had any idea, because in the beginning, when they first went to LeClaire Park, they had rainouts the first 2 or 3 years to keep it going, to pay the vendors, to pay the bands, to be viable. They had to take out second mortgages. So we are over the moon about being 50 years old for the Bix Jazz Festival. I get goosepimples just talking about it. We're really going to dress it up, and people are ready to party. And if I say nothing else, I want to tell people it's going to be a safe festival. If you want to wear a mask at the event center, at the Rhythm City Casino, you can. We'll have some to give out. There will be seating for 2 or 4 or regular seating. We'll have hand sanitation stations. So we want it to be safe, and we've been planning 18 months for this, so we're looking forward to it.
Yeah, I really did want to underline that as well, because I know you don't want to look back, because last year was tough. It was virtual, and you tried to have a fundraiser along with it in order to help pay for this year. And as you said, you've had more time to plan for this 50th. How tough was last year, and how did it pave the way for this year?
Well, normally I wouldn't tell this to most people, but I became physically ill. It was difficult. We had 4 bands recording at their cities. We recorded 2 at the Rhythm City Casino. It was like a 6-hour television production, and it was a lot of stress. We spent a certain amount of money. We made about 64% of that back. So we didn't have too many complaints, but at least I didn't want to have a 50th without having a 49th. So and you were there. We did a heck of a job, all things considered, but pulling together that from out of state, not easy.
Yeah, not easy at all. So let's forget about the past. Let's go to the future. Tell me about this 50th, because you got some great bands out there again.
You know, we do. And I know that people don't recognize the Mortonia Sextet or Cakewalk and Jazz Band, but some of these have been favorites for a long time. We've only got really one new band coming. We've got bands from Denver to Toledo, Minneapolis to St. Louis. I kid you not. You see pictures all the time, Jim, of people nodding their head and tapping their toes. These guys will get you out of your seat cheering. The musicianship is so good. We've got one guy, he plays with symphonies all over the country. And we're going to have, of the 8 professional bands, we're going to have 2 that are all-stars, including our own Davenport's Josh Duffy's Greystone Monarchs. And then we've got the Bix Youth Band. You think, well, teenagers. They are led by a guy who's been a professional musician for 56 years. His standards are very high. He says this band is good. And we've already heard them once, and they were right on. So they've had a couple of rehearsals since then. And I want to emphasize, this is traditional jazz. I love Dave Brubeck. I love smooth jazz. But traditional jazz is the 20s and the 30s. We get into a little swing of the 40s. It's fun and funny. It's this close to ribald. Wink, wink. So, there's a lot going on, and we've got a great lineup, and I call it a 3-day party. We're going to have a lot of fun.
Well, and you know, the thing that really should be pointed out is they're basically on the stage for 45 minutes. So it's like you're going to get exposed to a whole bunch of different interpretations of that period of jazz, and I think it's not just one type of music.
No, well put. We've got 3 bands that have got singers. We've got, you'll hear slow, you'll hear fast, you'll hear very fast. But I like to say some of the, one of the song titles, the one I can repeat is, "Oh baby, don't say no, say maybe." I mean, you laugh, but they don't write them like that anymore. and there's some funny stuff.
Yeah, a little wink, wink, as you said. I love the fact that you are talking to us from the Bix Museum inside the River Music Experience. Right behind you is a bunch of pictures outlining the history of Bix, and I believe there's a famous piece of equipment off your left shoulder there. Is there a cornet? I'm sorry, let me double check. You're right.
I'm
right.
I'm gonna bear with
Yeah,
me. Here we
take
go.
a look.
Here we go.
Yeah, what is that over there? It's my left, your right. Yeah, that's the rest of the museum.
There's the stage for people who haven't been here.
Yeah.
There's a lot. I don't know if you can see way over there. There's
Yeah,
a
we're looking,
clarinet.
we're watching, yeah.
Yeah, and this is in the lower level of the RME building, River Music Experience, which is at 2nd and Main, and I'm down. Our office is down the hallway, and we are. Gosh, I'm not sure how that looks, but this the Bix Museum then is, and I'm going to turn it here, and the Bix Museum is just down the hallway, and Nate, if Nate's standing over there, he's the director. We're going to just show you.
Hey, Nate.
We're going to show you. They've got a piano that was owned by Bix. I think they've got some,
I saw that, yeah.
some instruments that were owned by Bix. There is I don't think there's interactive, but there's recordings, there's music. There is a ton of stuff here. I like to say that. Okay, here we go. I like to say that you can do this museum in 20 minutes if you have to, but it's a very easy hour, and I can recommend it. It's not a big museum, but everything is well situated. It's easy to walk through, let's see. Well, real quick, it's what's the website? BixMuseum.org.
Yep.
So there you go.
You gave us a great tour, but I think I want to also underline the fact that we're talking about the 50th year of the Memorial Jazz Festival. We've got the Bix Museum there in the RME where you are sitting proudly. This community is celebrating Bix in a stronger way than ever before.
Yeah, and let me tell you, for those who can't come, as well as those who can, we're going to have a 50th anniversary, either DVD or thumb drive, your choice. You can sign up for that on our website. You can call and say, I want one of those. So if you can't come or you want to remember it, we're going to have about a 75-minute video that will showcase the entire festival, with interviews from fans and people who've been around. Our Bix historian will be there. So we're going to offer that. And you're one of the first that's going to hear this. We're pretty sure we can pull off some streaming. There are people who have mobility issues, Jim, money issues. They don't have the COVID courage to come. We get that. And there are people, particularly last year, I'm glad you brought that up, people were thrilled that they could see it on our YouTube page. Well, go to our website and you'll be able to learn about the streaming. We'll have a little paywall, but there's 5 concerts of 5 hours each. You can buy one or you can buy all 5. And so we think we can stream it around the world. And I think that's the way to go.
Steve Traynor, president of the Bix Beiderbecke Memorial Jazz Festival. On the air, on the radio, on the web, on your mobile device, and streaming on your computer. Thanks for taking some time to join us as we talk about the issues on the cities.
Whelan Presley Funeral Home and Crematory, a proud supporter of WQPT, has been serving Quad City families since 1889. They now have live stream capabilities for viewing your loved one's funeral or memorial service.
At IHM VCU, we've always been here for you. You are and always will be our top priority. We care about your financial and physical health, and we are here. IHM VCU is a proud supporter of WQPT.